It's necessary to ask the question is because, first, it looks odd that they will add babies. Number two, I know from looking at the importance of statistics in population planning that the claim that we need responsible parenting is because our population is still exploding. But if we do not add babies, maybe it will not explode. And in fact, it is not exploding. So as I calculate the statistics without the addition or without the padding, we will have to be worried about our population growth. The conclusion that I come to by looking at the figures is that by the year 2016, 6 years from now, our average number of babies per woman will be less than 2.1. As you know, the non-replacement rate, or the number of children per woman where the population of a country begins to be in danger, is 2.1. And I think you know that 2.1 is because 2 are needed to replace the mother and the father. And the 0.1 is because some babies do not live very long, infant mortality. So when our fertility rate, that is the technical term for the babies per woman, when our fertility rate goes below 2.1, we become an aging population. Even after we drop below the non-replacement rate of 2.1, our population will continue to grow because people will live longer. So our population will become an aging population, like what happened to Japan, Europe, and so on. And just to give you some shocking results of an aging population, in the news last week, Russia, the Russian interior minister was begging his government to allow immigration of 1 million workers per year, because otherwise their public services will suffer. And 1 million workers per year will increase for Russia. And Russia is not a very big population, as you know. So their problem is alcoholism. In their case, aside from practicing abortion, their bigger reason for the population collapse is they drink too much vodka. And so they cannot have too many children. But Italy needs about 1 million immigrants a year also. Europe in general has a very bad case. Japan is closing down several thousand schools a year. So these are the results of population decline. But our statistics, because they add babies to the statistics, are not showing this decline. It looks like we are still a normal growth, but in fact our population pyramid has started to decrease at the bottom. And it's just not showing yet so badly because of that addition that they did. And so we had a scientific meeting 2 days ago, and they still try to justify that addition. They claim it is scientific judgment of the demographers of the National Statistical Coordination Board, but that is not acceptable as far as I can see. But it remains a difference in judgment between my judgment and their judgment. So I'm only one. There are so many people outside, no? So I use the analogy to peritonitis. You're familiar, I think, with the case of an appendectomy or an appendix which is not treated. Sometimes when a doctor receives a patient who has a stomach ache, if the doctor does not diagnose it properly, he will just give a painkiller like a Tylenol or an aspirin to kill the pain. And so the pain will disappear, but the infection remains inside. And eventually the infection bursts into what is called peritonitis, which makes sometimes the patient die, or sometimes if they can keep him alive, it's a very severe operation. I told the statistics people that the National Statistics Office that they may have a case of peritonitis because by masking the statistics like a Tylenol, by adding babies, they do not see the decline in population, and they fail to warn the population like us that we have a problem already with our population growth, that we are going to become an aging society with a collapsing population also. So they are masking it by adding babies, like a doctor who masks the pain with the Tylenol, and eventually will result in a peritonitis. In our case, we will have a demographic collapse by this addition of babies. So it still remains a discussion that we're having with no conclusion, because there's so much, I guess they have to support their position that they've had for many years also. So that's the background of this addition of babies. Thank you.
Magandang gabi po, dear panelist. Siguro, pamilyar po kayo sa nangyayari sa ngayon. At this point in time na the poor become poorer and the rich become richer. And add to this, kung sino pa ho yung mahihirap, ay sila yung maraming nag-aanak. At saka yung mayayaman, kokonti po ang anak. Doon po sa unang proposition, hindi po ba ibig sabihin nito na may pagkakanya-kanya tayo? Na sa mga mayayaman, ibig sabihin nito, sa nangyayari sa ngayon, bahala kayo kung kayo mahirap. At ito namang mga mahihirap, gusto man nila na gumanda ang buhay nila, ay parang nawawalan sila ng sigla o pag-asa. At yun na lang ang leisure nila sa buhay, yung gumawa sila ng gumawa ng anak. Ganito po, in spiritual and economic side of view, kung titignan po natin yung term natin ngayon na pinag-uusapan, yung responsibility, sa tingin ko, nagdi-decline yung responsibility natin dahil nagkakanya-kanya tayo. We are not using the Word of God. At yun pa naman ang nakasulat ngayon, na yung sense of responsibility to each other, na much is required from the person to whom much is given. Nawawala po tayo sa utos ng Panginoon. Nagkakanya-kanya tayo dahil sa dikta ng pita ng laman. At yun ang masakit. Ito nga ang nagiging resulta. Siguro, hindi pa naman siguro huli ang lahat na gumawa tayo ng aksyon ngayon na gamitin ang salita ng Diyos. Father.
Salamat po ng marami. Una po, tama po yung nabanggit niya. No? Kung papansinin niyo po, sa so-called squatters area o slum areas, doon po maraming anak. Samantalang, pasensya na po sa word na to, kung sa White Plains, sa Alabang, kukonti ang anak.